Good morning, everybody. Thank you for joining me. I am Christy Wilbert, Vice President at URL Insurance Group, and I'll be hosting today's webinar. We will be going over Medicare Supplement versus Medicare Advantage Plans. Our goal really today is to make sure that you feel like you're fully educated on the difference between the two, so that when you are presenting that in a sale or on an appointment, you can fully educate the consumer or the individual on what they're purchasing. We do believe that it is not a cookie cutter plan out there. I hate to hear when agents are saying, I only sell Medicare Advantage plans or I only sell Medicare Supplement plans. We here at URL truly feel that you are to be an educator and make sure everybody is aware of all of their options and decide together what is best for that individual. So that's what we're going to go over today. We did have a few other educational webinars this month. You can find them on our training calendar or in our training library. We have another one coming up next week to dive deep into prescription drug plans. So if you want to register for that, that's also on our event calendar on our website. All our webinars are recorded, so you can go back and watch this at your convenience at any time. There is an area there for question and answer and to chat. Please feel free to use that today while we're going through everything. I'll try to make it as detailed as possible, but feel free to interact. All right, let's get started. So basically, to start off, I just want to go over Original Medicare really quickly. And for those of you that missed it, we did have a very lengthy Original Medicare webinar that Social Security did about a month ago. They usually come to our conference as well, which this year is August 24th. So if you want to come learn more about Original Medicare, that's a good webinar to watch, and that will be a good presentation at our conference. But to get into Original Medicare A and B, they're either enrolled automatically if they're already collecting Social Security, or they do have to enroll themselves manually. And the easiest way to do that is online at socialsecurity.gov. The other option is to go down to your local Social Security office. Now, your enrollment window is 3 months before you turn 65, the month of your 65th birthday, and then 3 months after you turn 65. There's no more waiting period anymore. If you enroll early or late, you're going to enroll the next month, which is really great. That's for the general enrollment period and the IEP. If you are working past 65 and you are on a large group, meaning 20 or over in you're employed by the same employer, your Medicare isn't necessary. Okay, it's going to be secondary, so you don't need to enroll into A and B. You can reject that and save those premiums. But if you are a group under 20, you do need to enroll into A and B of Medicare. It is required, or you'll get penalties later. Medicare would be primary in that circumstance. Your group plan will actually be secondary. So you want to make sure that you're guiding your clients in the right direction there with the Original Medicare. Me personally, I believe that if they have to pay for their Part B premium, I don't see why they wouldn't just come off the group and go onto a Medicare plan, unless they're working for an employer that's paying 100% of their costs, which doesn't really happen that much anymore with healthcare and the employer contributing. So you do have an SEP when you come off the group or COBRA. If you are over 65 and you go onto COBRA, you have 8 months to enroll into your Part B. That's your window. And then when you come off the group plan, you have 63 days, which is your SEP if you're already on B, to enroll into a plan. If you don't use your time periods correctly, you could result in a penalty, as we mentioned before. For Part A, it's a 10%, and it's 2 times actually every year that you miss enrollment. For Part B, it's 10% for every year that you miss. And for Part D, it's 1% of the average Part D premium for every month that you miss. And you pay all these penalties for life. So you definitely want to avoid them. Okay, so what does Part A cover you for Original Medicare? This is your hospital. coverage. It should be premium free. That doesn't matter if you're going off your spouse, if you're divorced, if you're widowed, as long as somebody somewhere, husband or wife or spouse, has contributed those 10 years or 40 quarters into those taxes. There is a per benefit period deductible on this. It's $1,600 in the year 2023. Per benefit period is every 60 days. So you could pay that multiple times in a year. And that's why you need to buy an additional Medicare plan to pick up that risk of financial loss. Part B is your medical. So this is when you're going to see any of your doctors, if you have outpatient care, tests, labs, supplies, anything. This does have a premium attached to it. We're going to go over what those premiums are based off of your income. And you also have an annual deductible because they have to make it extra hard. So the first one's per benefit period, and the second one is an annual deductible. In the year 2023, it's $226. Now, we expect all of these numbers to go up for 2024 as they do traditionally. After you pay the annual deductible, you still have a 20% coinsurance. So you're never covered at 100% on the Part B if you don't buy an additional Medicare plan. So again, if you want to avoid some financial risk, you want to pick up a plan. The Part B premium, like we said, that all goes off of your income, and it is 2 years prior than the year that we're in. Most people are paying the $164.90, which is base for 2023. You can ask Social Security to review your income at any time. So if you had a major difference in your income and you just filed your taxes, you want to have that reviewed, you just contact Social Security and they can do that for you and maybe change your premium. Now, this charge does come through on your Social Security original Medicare invoice. If it's not being deducted from your Social Security benefits because maybe you're not taking them yet, you do receive a quarterly invoice. You may have some discrepancies in that invoice. I definitely tell people to check them over and check them with a fine-tooth comb because you actually may get multiple. So it's hard to make sense of them, especially if you do have an IRMA charge. IRMA is just the additional premium that you have to pay for Part B and Part D. So you just want to make sure that you can make sense of that when you're taking a look at it. All right, this is a little chart that we like to use. It's on the Quick Look at Medicare guide. CMS created this chart, and I don't think it can get much simpler if someone's a visual person to see their Medicare options. As you see there on the left, it shows the Part A and Part B of Medicare that we just went over, and you either have the option to get a Part D plan and a Medicare supplement, or the alternative is to pick up a Part C or a Medicare Advantage plan that includes the drug plan in it in most cases. So we're going to dive into the difference between the two. Enrollment periods are different for both, of course. So Medicare Supplement, once you enroll into A and B and you have your effective date for that, you can enroll into a Med Sup for 6 months. So you have a 6-month window for that. The AEP that you hear every year from October 15th to December 7th does not affect Medicare Supplement plans. Rates can change based on attained age or if they had a rate increase, if it's community rated. And that happens on an annual basis, and the person will get a package at their renewal. It could be in April, it could be in July, it could be any time of the year that they decide to do a rate increase. So if you have your clients calling you at the AEP about a Medicare supplement, you can politely let them know that the AEP does not affect them unless they're on a prescription drug plan, which you can review every year. There's no disenrollment period for the Med Sup. You can really quote a new Med Sup at any time. You're just going to have to answer the health underwriting questions. The only time you can avoid those health underwriting questions is in that first initial enrollment period of that 6 months, or if you have any kind of qualifying life event that gives you a guarantee issue. On the Medicare Advantage side, it's the same 7-month window as original Medicare. So it's the 3 months before you're 65, your 65th birthday month, and then 3 months after you turn 65. Now, the AEP does affect the Medicare Advantage plans. So every year between October 15th through December 7th, the individual does have an opportunity to see if there's anything out there that better suits their needs. Maybe it's because of their doctor or their network or the hospital that they're going to now, or they've moved, or they're looking for something specific in their plan that's not being offered. We have a lot of Part B buybacks right now. So just to give a few examples. There is a disenrollment period. It is during the open enrollment period. So they're one and the same, which is January 1st through March 31st. The reason why this is done is so that when a person does switch a plan to the new year, it gives them the opportunity to go use it. So they have that 3-month window to use the plan, make sure it's working the way they expected it to be, or they were told it was going to, that their doctor accepts it, all that good stuff. And if it doesn't, they can come back to you and switch their plan. You have to switch from like plans. So if you have Medicare Advantage, you have to go to Medicare Advantage. Or you can come out of Medicare Advantage altogether, go back on original Medicare, and pick up a Part D plan. And then there's those special enrollment periods as well. We're not going to go over the special enrollment periods today for MedSup or Medicare Advantage plan, but we do have them posted on our website under Medicare Tools. And both are listed there in complete lists for both. Or you can find them on Medicare.gov with a simple Google search. Okay, so how do you evaluate what is best for the individual that you're working with? These are some example questions, like how often do you travel? If there are people that go outside of the country a lot, maybe a MedSup is better. What is your health care budget? If they can only spend, $25 or less a month on their health care or their health insurance, Medicare Advantage might be the way you want to go. This is more of a risk assessment question, or how they feel about budgeting. Would you like to pay now or pay later? Would you rather pay more upfront for less out-of-pocket costs when you visit the doctor? Or would you rather pay little to nothing and then have a cost when you visit the doctor? Everybody is different. And then explain premiums versus out-of-pocket max. So a premium is what you pay monthly, and you're going to have to pay that regardless of what happens. Like the Part B premium, for example. If you pick MedSup or Medicare Advantage, you're always going to have that Part B premium. That does not change. And out-of-pocket max, I like to explain it like a second deductible. So that is something that once you hit it, it's kind of like a catastrophic safety guard. After that, you're covered at 100% of the costs. So if you ever hit that large, scary number, you don't have to pay anything in addition to it. Okay, so we learned about MedSup. We're going to learn about Medicare Advantage plans. Okay, so this combines your Part A and B and can also offer prescription drug coverage. It's managed by private insurance companies. And you have things like co-payments, co-insurance, deductibles for services. Makes it really easy to compare plans side by side because you're looking at the things people are going to use every day. I'm always looking at what are they going to pay to see their primary care physician? What are they going to pay to see a specialist? What happens if they're hospitalized for some reason? What if they get lab work regularly? I'm checking that. Just to throw you a few examples. May cover certain services not covered by original Medicare, such as dental, vision, hearing, fitness, over-the-counter, that Part B buyback we were talking about. And you must have both A and B in order to enroll. A lot of people are scared of Medicare Advantage plans like it's something new, but it actually works like a traditional HMO, PPO, private fee-for-service. So if you're on a group health plan your whole employment career and you have a PPO with a carrier, this Medicare Advantage plan is going to work exactly the same way. The network might change a little bit because you're with one carrier for your group and another carrier for Medicare doesn't mean that the same facility works with both plans. But you should be familiar with the process. You go to the doctor, you pay your copay, or you have the deductible you have to hit, you have your copays for your medication. It's something we're used to. To me, it's actually the Medicare supplement that takes a little bit of wrapping your brain around to understand how it works. Okay, so we're just going to dive a little bit further into the Medicare Advantage plans, showing it against original Medicare. So is there cost sharing with Medicare Advantage plans? Yes. So you have little to no deductibles with Medicare Advantage plans. Some even work now where there's no deductible unless you're out of network. We've been seeing that a lot. Copays and coinsurance. What coinsurance means is instead of a set dollar amount, it's a percentage, like 20%, for example. A lot of times with a Medicare Advantage plan, your biggest expense can be that Part B, like durable medical equipment, for example. You have a 20% coinsurance. It used to be a huge risk as well with diabetes medications, but because of the Inflation Reduction Act and the Part B sponsorship, that's gone away. So that's been wonderful. Hopefully, maybe they'll do the same with durable medical equipment down the road. Supplement insurance. You can't have a Medigap or Medicare supplement as well as a Medicare Advantage plan. You'd be insured, so that wouldn't make any sense. Extra coverages, nothing's included with original Medicare, but if you have a Medicare Advantage plan, you will get all those extras. Like we mentioned before, the dental, vision, hearing, fitness plans, over the counter, nationwide coverage. So original Medicare is accepted anywhere that accepts Medicare. Medicare Advantage plans do have a network. Most are nationwide these days. The carriers have been large enough that they do have nationwide networks. Or if it's a Blues carrier, for example, they have Blues all over nationwide, so they share networks. If it is a small company that's like local to you and maybe they don't have a nationwide network, they usually now have in and out of network benefits that match. So as long as the facility that you're going to is willing to bill out of network, you should have no problem using a Medicare Advantage plan. So referrals to see a specialist, maybe on a Medicare Advantage plan. If you have an HMO, that has really gone away too for the most part. Prescription drug plans not included in original Medicare, but you do have that in a Medicare Advantage plan built in unless you buy the MA only plans. And the only reason people usually sell those is for veterans, maybe because they pick up their drugs at the VA. Out-of-pocket limits, so there's no cap on either. Is Medicare Advantage the right choice? So I feel like a pros and cons list is always the best way to be fully transparent with the client on what they're getting into. So the pros of Medicare Advantage is obviously that lower monthly cost. I mean, you can get a great plan for $0 that's a PPO these days. And if you want to spend a little money, there are low premium monthly cost plans that have very, very rich benefits. So, and we like to say pay as you go. I explained that earlier. So, if you're not going to use it often, it's not going to cost you a lot, but it's there in case you need it. And when you do use it, that's when you're paying for it. It comes with the extra benefits like the dental, vision, hearing, does have that out-of-pocket max protection that we talked about. You can adjust your plans annually if your needs change, which is very nice. There's no additional health underwriting questions for you to switch plans at the end of the year. There is travel coverage on most plans, and it has those nationwide networks like we mentioned. And some cons are the networks, for sure. You just have to make sure you're having network conversations before you go see anybody. Copays, coinsurance, deductibles do apply. So when you're using it, you're paying for it. May need referrals for specialists. As I said before, that kind of has gone away, but it's still something to note just in case. May need to change plans on an annual basis. Some people may see that as a con. Maybe they don't want to meet with their agent every single year and review their plan. They just want to, purchase it and forget it. Okay, so on the alternative, Medicare Supplement. So Medicare Supplement fills the gaps of original Medicare. So the A per benefit period that we talked about, that's $1,600, and the Part B annual, that's the $226, and then the 20% coinsurance. The Medicare Supplement picks all of that up. And all plans offer the same coverage. So when you run a quote for a Plan G and you get all of the carriers that offer the Plan G, the benefits are the same across the board. It doesn't matter which carrier that you're using. What you want to look at is on our quoting tool, we have a button called Marketing Analytics. When you pull that up, it's going to tell you what the premium is going to be for the next 5 years. And also it's going to tell you what the rate history has been. Did they take increases or decreases, and how long the plan's been in the market. You as the agent probably often sell the same Medicare supplement plan over and over because you get very comfortable with their customer service, maybe you like how fast they are at issuing applications. Those are all things that you should express to your client on why you're picking that specific carrier, since it really doesn't matter except for price. Okay, so Medicare supplement insurance sold by private insurance companies, also referred to as Medigap. Here are the different plan options. C and F have gone away unless you have Part A before 2020. So now the most commonly sold plan is Plan G, which covers everything but that Part B deductible. So that's that $226. You're responsible for that, and then everything is covered at 100%. Matthew, I would love to answer your question. Do you mind being more specific for me? Is Medigap the right choice? So again, pros and cons. So pros for Medigap are there are no networks, so it's accepted anywhere Medicare is accepted. There's less out-of-pocket costs after your monthly premium, so it is easier to budget. So say your plan is $105 a month, that's what you are paying. You'll have that $226 that will be billed to you. Don't forget the Part B premium, but it's a lot easier to budget that way. But some people don't have that much, on a month-to-month basis. Good for travelers within the U.S. because it has no networks, has that peace of mind. You feel safe. You don't have that co-insurance hanging over your head possibility. Pre-existing conditions are covered as long as you had previous insurance. Some cons are higher monthly costs. The Medicare Advantage plan price you can't beat. No extra benefits, so it kind of is what it is. It picks up those co-pays from the original Medicare, and that's it. Nothing else is included. So if you want a dental, vision, or hearing plan, you'll have to buy that in addition to, and you also have to buy a separate prescription drug plan. So let's just compare costs for a moment. And this is, just rates based out of here where we are in Harrisburg, Pennsylvania. So a Plan G for Medicare Supplement would be about $105. That's the lowest cost plan right now. And then if you want to purchase a drug plan, this is the average for 2023. It's $42. Now, obviously, there are plans out there that are much less expensive, but I'm just doing the average here. Dental, vision, hearing plan for $30. And you always have to pay your Part B premium. So you're looking at a budget around $341.90 a month if you want to take a Medicare supplement, which gives you all those benefits, no network, peace of mind, budgeting your premiums, all of that stuff. And then Medicare Advantage, you'll have your Part B premium, the $164.90. Medicare Advantage plans do go the whole way up to $200. The more expensive plans cover the drugs better, so that's why they range so differently. But most people are going to have a $0 PPO plan. That includes dental and vision and hearing, so that's why I put $0. So you're really just looking at a cost of your Part B premium. And there's even plans out there, like I said, that have the Part B buyback. So if that's the case, it could even be less than the $164.90. Okay, so here's some possible claim examples. And this isn't something necessarily that you need to go over with the client. It's just something that you want to keep in the back of your mind while you're assessing their health and where they should be taking risks in the future financially, because obviously both sides have pros and cons, which we just went over. But for Medicare Supplement, let's just say your annual premium is $1,400. That is going to continue to increase as you age, as we said. So, I mean, when you're 70 years old, your premium for Med Supp can be the whole way up to $250 a month. For Medicare Advantage, it doesn't change like that. We are very lucky to be in a very competitive market for Medicare Advantage plans. So they're designing, crazy enriched benefits and Part B buybacks to get the premium as low as they possibly can. So I don't see that changing anytime soon where they're going to come up in price. Annual Part D premium. So with a Medicare Supplement, you'll have to buy an additional Part D plan. That can cost you up to $504 and even more if you have a deductible on the plan. Medicare Advantage, it's built in, so $0. Say you have to go see your primary care physician. Medicare Supplement, after you pay that $226, so you're not going to get billed the $226 all at once. It's going to be like 20% at a time when you go see the doctor until you hit the $226, and then you'll be paying the $0 copay. With Medicare Advantage, you're always going to have the copay, whatever it's set at. So it could be $0. Some plans have $0. I just used an average of $5. So that's the difference there. Specialty visit copays, Medicare Supplement, after you hit that deductible, it's going to be $0. Medicare Advantage, it could be 10, it could be 15. I use 25 because it's an average. Durable medical equipment. So I put this one on here and I mentioned it earlier because this is the one area that you do have an exposure. If you're on a Medicare Supplement, it would be $0. If you're on a Medicare Advantage plan, for the most part, there's 20% coinsurance. Now, I will mention that if the Medicare Advantage plan works with a specific company that does durable medical equipment, there's usually less that you have to pay out of pocket, and they work with you on that. The other very large exposure with the Part B 20% coinsurance on a Medicare Advantage plan, unfortunately, is cancer. So if somebody has to go through chemotherapy, for an example, and that's something they might not know when you're meeting with them. They're 65, they're healthy, maybe they have history of cancer in the family. If they've had history of having cancer previously, I would definitely recommend a Medicare Supplement. No questions asked, because that is a true risk of the 20% coinsurance. And then the other thing I have listed here is MOOP, which is your max out-of-pocket costs. With Medicare Supplement, there isn't one. And with Medicare Advantage, that is plan by plan. I've seen some as low as like $4,300, and they go all the way up to like $7,000. So again, that is just the max you will pay out of pocket. So if your person, is healthy and 65 and they buy a Medicare Advantage plan and they're on that plan till age 80 and they have no health issues and they're paying their $5 co-payments, and then at age 80 they end up, unfortunately, with cancer and they have to pay that 20% coinsurance for chemotherapy. They have that MOOP protection. Okay, so if something catastrophic happens, not even with cancer, let's just say they're hospitalized and have to have surgery after surgery because something crazy happens. Again, that MOOP is there for protection. Okay, that's the max out of pocket that person is going to pay in a year's time. Okay, and lastly, I just want to go over commissions. I know as an honest and ethical agent, this isn't going to be taken into consideration when you're selling to a person, but I just want you to be aware of the difference, okay? Medicare Advantage, I'm not going to go over the specific numbers because you could work at an agency and you should be, you have an agreement with your agency principal about how you're paid. But there is a full amount that's set by CMS every year. It's the fair market value, okay? And you only get paid that when it's a true new to Medicare. So that means they're either turning 65 and going on Medicare for the first time ever, or they're over 65 and coming off the group plan, and again, enrolling into Medicare for the first time ever. So that's why we always say that this isn't an AEP game, okay? That's not the time that you want to be growing your book of business. You want to do it all year long because people are retiring all year long. July 1st is actually our highest business month ever, the whole year, even more than AEP, because so many people are retiring over summer and the end of the year, December 31st. So make sure that you're doing marketing throughout the year to pick up those people that are coming on Medicare for the first time, because that's when you're getting the larger commission. Every year when they renew their plan January 1st, you are now getting the renewal commission. Okay, so if you switch somebody a plan, doesn't matter, you're getting the renewal. If you're stealing a person from another agent, you're getting the renewal. They're not on Medicare for the first time. There is something also I just want to make you aware while I have you, called rapid disenrollment. So if they don't stay on the plan until April, you're getting your full commission pulled back. Okay, so they need to stay on. When the renewals are paid now, everybody is paying as they renew. So month by month. The first year it's lump sum. Doesn't matter what month it is. If it's May and that's the first time on Medicare, it's the same amount in November. It's one lump sum for the first year. Renewals are monthly. Okay, Medicare Supplement, that pays a percentage of the annualized premium. Okay, so whatever the premium is for the year, it's a percentage of that, and that's also paid on a monthly or however the client pays. So if the client pays quarterly, you get a percentage of that commission on a quarterly basis. If the client pays annually, you're going to get paid annually for that client. So what they're trying to do is make sure that there's no taking backs of commissions. We want to make sure that we're not, pulling back, we're only paying out. So you're paid as the companies are paid. Okay, and if you're not using Medicare Now already, please use that. It's a great tool to compare Medicare Advantage and prescription drug plans. There is an electronic scope of appointment out there for you, which now we have the 48-hour rule with the scope again. So that should be very helpful to help you prepare for appointments beforehand. It stores all the client information, including drug lists, doctor's lists. There's areas for notes so you can remember things about the client and what's important in their health care. It does let you quote and enroll via email or text message, whichever is easier for your client. And you can be face-to-face or over the phone with the individual. Medicare Now does have recording capabilities as well. Okay, so the big takeaways from today, really, I can't stress this enough, is to be an educator. They're looking to you to guide them. So ask questions to make sure that they're understanding what you're explaining along the way. Make sure that you're guiding. Like if this is your type of person, or if this is a fit, then I think this is what the best thing is for you over here. Use your knowledge and expertise. I always like to use the example because I used to be a PNC agent. What type of person are you? And ask them that. Are you the type of person that you pay off your vehicle and you get so excited to take the full coverage insurance off of it so you can pay less insurance premium, and if something happens, you'll just worry about it then? Or are you the type of person that it's a 1999 beat up junker and you still have full coverage on that thing because if anything happens, you don't want to come out of pocket, and that's just peace of mind for you. So you really find that out as you assess their risk, as you assess their health, their medication, their family health, what kind of doctors they see. You can find out a lot through that appointment and their process to guide them. Building rapport, what are their needs? Where are they traveling? What are they doing for a living? How are they spending their time? What are their needs? Do they need to see a specialist? Do they need to see a certain hospital? And what are their wants? Do they want an over-the-counter benefit on a quarterly basis so they can buy their toothpaste and Band-Aids? Is that something special for them? Do they want that Part B buyback that doesn't come on all the plans? Use a leave behind item or package. A whole folder of information is great. We have some great things out on Medicare tools that you can download and use and edit. Put your name and agency information on it. so that they know that they've met with you and who their agent is and who they're calling every year. And then follow up after your appointment, okay? Let it go a week or two, touch base, see if they got their enrollment phone call from the carrier, see if they've gotten their cards in the mail. Just touching base is very personal and keeps you in front of the individual. And they have an opportunity to ask questions then as well, because I feel like after you leave, they're always thinking of things they wish they would have asked but didn't get the opportunity to. It's a lot of information at once. And last but not least, get ready to reconnect with us at our Hershey Lodge Medicare Connections Conference. Again, it is August 24th, I believe. It starts at 8 or 9, and then we'll run till 4. We do have some great presenters. We're going to have some marketing chats, so we really look forward to mingling and spending some time with you. Okay, so let me see what Matthew said here. We do have a question. How do we explain the difference in costs if we're not familiar with customer service with the carrier? Some of these plans range a difference of $40, and it feels like a guess. I want to make sure my clients get the best coverage possible, but without experience, it feels difficult to understand, explain. Well, Matthew, if you are talking about a Medicare supplement, which I believe you are because that was your initial question, you should not be even looking at the ones that are $40 more. Because as I explained before, if you're quoting a Plan G, it's a Plan G regardless of what carrier you're going with. So you should be picking from the top 3 or 4 carriers, and they should only difference in like $5 or $10 a month. And again, push that marketing analytics button. Look what the premiums are going to be over the next 5 years. Look at rate history. Look how long they've been in business. So those are the 3 things that you can see right off the bat that's going to help you even if you don't have customer service experience with those carriers. Can you better explain the Part B buyback, please, Christine? Of course. So some of the Medicare Advantage carriers will offer a Part B buyback, and you'll see that when you run a quote in Medicare Now and you do the side-by-side comparison. There is a line item for that, and it will say 0, 25, 50. So what that means is the carrier is actually giving the person back $50 to their Part B. So if they're paying $164.90, they are paying $114.90. Did I do that math right? Yes. So if it was the $50 Part B buyback. I am not getting supplement plans to come up under Medicare Now for my area. That's because Medicare Supplement, you quote under CSG quoting tool that's on our website. The Medicare Now quote and enrollment tool is only for Medicare Advantage and prescription drug plans because they dive really deep into comparing side-by-side benefits and what the prescriptions are going to cost you when a Medicare Supplement is a simple quote. So it is on a whole different tool. Okay. Well, thank you so much for asking questions and interacting with me today. I hope you found this valuable. Happy to talk to anybody one-on-one. Today I'll be around, and I look forward to working with all of you much more. Have a great day.